Nick Drossos.
Dr. Andrew Steinberg.
And welcome to another episode of
Have the balls to talk about it.
Today, Andrew, a topic I know nothing about.
Yes. So today we've talked a lot about erectile dysfunction. Obviously, it's a major issue, but we're going to sort of focus a little bit on one specific cause of erectile dysfunction, which doesn't get a lot of loving, and that's venous leak. Venous as in veins, leak.
Okay.
So I guess, on a broader spectrum, we know that the incidence of erectile dysfunction is super high. Probably some of the numbers I've seen in the past, 30% of 30-year-olds, 50% of 50-year-olds, really high numbers. It's a major cause of anxiety, depression, marital issues, relationship issues, and so on. And the causes are multifactorial. I guess I talk about normally the four pillars of erectile dysfunction, which would be psychological or psychogenic, performance anxiety and that realm. The vascular causes, which is what this talk is going to fall into, hormonal, testosterone, and so on. And then the neurological causes. Now, neurological causes are usually caused by pelvic trauma or prostate surgery, which damages the nerves to the penis, maybe sometimes in diabetic, which have nerve disease. Psychological, performance anxiety, that's probably part of every erectile dysfunction. But as younger, healthy men probably have a higher incidence of it. But I think any man who has, at any age, some erectile dysfunction starts to think about it, and then the next time they're having sex, it's, am I going to get hard? Am I fully hard? Am I going to be able to penetrate? All that stuff, which just makes things worse. Testosterone typically has more of the lower sex drive, lower libido. Again, we've talked about this a million times. And then the vascular causes. Now, none of these is a separate circle. These are all overlapping circles, and probably every case of erectile dysfunction involves a little bit or part of one or more of these different pillars. Now, vascular, when we think of the vascular part of erections, we think about the blood flowing into the penis. We need to get as much blood flowing in, which is how most of our treatments are based. More arterial flow, Viagra and Cialis work on phosphodiesterase, which works on nitric oxide, which opens up the arteries to the penis to allow more blood flow in. The whole mechanism of erections is these sponges opening up and blood flowing in. But there's a second side to that. If blood were to flow in, it needs to stay in, to stay hard. So blood actually comes in through the arteries, but it comes out through the veins. And the mechanism how these veins sort of block off is as the penis expands, it pretty much compresses the veins. So a lot more more blood flows in and less blood flows out. So it blocks the veins. Veins is what carries blood away from the different parts of our body. So when this is a mechanism that could be affected. So if you have good blood flowing in, but too much blood is flowing out too quickly, you're not going to be able to maintain or get a full erection. So that's venous leak. Now, venous leak is potentially, again, depends of how this is counted, how this is looked, and how well you look, but could make up a lot bigger percentage of the cause of erectile dysfunction than we think. And some studies say maybe as much as 30-40% of organic causes, not psychological causes. But again, these things not easy to study. And
how would somebody know if he has a venous leak?
Well, some of it is based, typically it's based on measuring it. Okay, we measure the blood flow. We do a penile Doppler where we inject something into the penis to give you a good erections, and we measure the systolic and diastolic, which is like the blood pressure measurements essentially. And people who have
measuring just the penis, the blood that circulates.
Yeah, we look at the flows at the peak, and then we look at the flows at the bottom. And people who have the arterial aspect is how fast your blood flow is in. But if the blood pressure kind of drops rapidly, or the end diastolic velocity, that's a sign of a venous leak. So basically you're measuring in a way how fast the blood goes out, and you're comparing it to what the norms are. You can do some imaging and injecting dye and watching it in, but those are impractical and not used whatsoever. So pretty much the penile Doppler ultrasound is the test of choice. Some people think that's coupled more with the type of erectile dysfunction that you have. Like if you're able to get an erection but you lose it fast, maybe it's because the blood is flowing in and then you just can't keep up, so that's when you lose it. I think I think all types of erectile dysfunction can cause that, certainly psychological. You start off good and then you start to think about things and you lose it. So I think that's just a rough guide to it. What can cause venous leaks? Again, not very well studied. I think anything that can affect the arteries in your body can affect the veins, your endothelial functioning. Trauma to the penis can definitely cause it, and trauma can also mean surgical prostate surgery or penile surgery and of any sort.
If you have a venous leak, would that mean there's something else within your system that's...
Not the same thing like we think of with arterial disease, where we believe, if you have a 35-year-old with arterial disease to the penis, we send them for a cardiac workup, but not the same thing as believed of that. Underlying conditions, medical conditions can be a potential cause: diabetes, high blood pressure, similar to all cardiovascular risks. Some medications may exacerbate it. They talk about aging can affect the vascular and smooth muscle tone in veins. We get venous insufficiency in our legs. People start to get these swollen legs. And of course, the regular culprits. Now, how they exactly impact it, smoking, obesity, alcohol, can they potentially contribute it? Again, they contribute to so many things. It's hard to isolate what their direct impact is on it. Now, I guess testosterone, does have some effect on endothelial function. So low testosterone, again, limited studies, but low testosterone may exacerbate or worsen that. So there is some studies which testosterone, or some belief where testosterone can help the vascular studies, both arterial and venous. So it's not just about getting you horny, but there may be some, or libido high, but there may be some role for testosterone therapy in pure erectile dysfunction. But how do we fix it? So this is the issue. We can't directly repair the veins. We can't directly get the veins to squeeze more, like we can get the arteries to open more. We can't do that with veins. And the best, so I really tell patients there's no targeted therapy to treat venous leak. So really the best way to do it is to get the best erections possible, which will put more pressure on the veins, which will close them off better. Okay, so
so there's no procedure for this, is there?
There's not really any procedure. People have tried to do surgical procedures and tying off the veins. Again, I don't think it's very practical. I don't think it's something that's used across the board. But I basically, work with people with all the tools that we have, sex therapists, cognitive therapy to deal with what's going on in the brain, between the ears. Viagra and Cialis, shock therapy, platelet therapy, if you're a believer of that, injection therapies like Trimix, prostaglandins, and all the general stuff, of course, all the general health stuff, quitting smoking, optimizing your lifestyle, your healthy lifestyle, and so on. The only thing which I kind of makes sense, and I'll explain in a second, that I really add to the table with patients I've diagnosed as venous leak, is the good old-fashioned cock ring, the penile ring. Because what it does is it squeezes the penis enough that it blocks the blood from coming out.
So it goes in and then block.
Exactly.
But doesn't it block, and it's a stupid question, Andrew, but doesn't it block from coming in?
Well, that's the thing. The pressure in an artery is much higher than the pressure in a vein. So if you do that relatively tight, not too tight, but relatively tight, your blood's still going to flow in. Okay. But you'll block the veins enough that you'll have less blood. So on these things here, I back
I'm
up.
like, is he? I'm like, what is he gonna do?
No. I keep one in my front desk.
We should, you know what, Andrew?
You know.
We should do a whole show on this. Like, this is.
So
like,
this one's $12.
It looks more like a cigar cutter.
Yeah, well, exactly. So I bought it at a at a sex shop, and they have fancy ones. They have ones that vibrate. They have ones which you can little thing that you can cinch in. This is just strictly a little plastic one, and you kind of pull it apart and put your penis in there. Put it down to the base of your penis. Well, I think they have different sizes. I think you should wear a lot of lube. The problem is that if you have really weak erections, it's going to be hard to do, because it's going to be hard to put on. You have to be a little bit erect, enough erect that you can, because again, these things it's a rubbery tube. You want it to stretch out.
We need an episode on this.
So, so these actually, and some men actually have a lot of help on this. So for $10, $12, whatever it is, a good old-fashioned penile ring can help a lot. So like everything, it's good to take a holistic approach to your sexual health, your erectile health. Is it necessary to diagnose venous leak by doing a penile Doppler? Not always, not necessarily, because again, we don't have targeted therapies. But I think working with a good and knowledgeable healthcare provider who does erectile dysfunction, working with a sex therapist, working with Nick to get you into shape, and don't have the balls to come out and get help and talk about it, and really try to get a more the best kind of therapy for your lifestyle and your issues as possible.
It's a very interesting topic. Andrew, we got to talk about this. Guys, I hope you enjoyed this episode.
I've had the balls to talk about it.
Put it in here, Andrew. Let's squeeze. Could you put it in there or no?
Some people actually have some where they put it on over their penis and the base around their balls also.
Guys, I'm always learning something new. Hope you guys enjoyed this episode. Thanks for watching.